expect anything less of you.
Absolutely.
In their OR.
Yeah.
I mean, who knows if it would be an issue.
Well, they have it.
Right. So we can't be.
Well, and that's.
Hi there. Hello.
Yeah, they're adequate. I mean, hard. I haven't seen you in forever. How are you?
Let me go through and I'll make notation. I can do that right out of the street.
That's it.
Yep. Watch the blood pressure. Blood pressure. What can I help you with?
Jim, how are you, sir? I'm good. Wayne.
Alexander.
Thank you again for all your great help at many different levels. How's your world? Your real world, not this crazy. It's home, family, the real world. Good.
I have a question. Okay.
Yeah, absolutely.
Yeah, I was. Where are you?
I'm on the corner right there.
Yeah, no, you're all going to have to do it. Yeah, do well. Yeah.
Meeting will come to order. We have a quorum. Members, please take your seats at the dais. Audience members, please have a seat. Please turn off all communication devices, things of that nature. Good morning, one and all. Welcome to our first full meeting of HWI for this short session.
Yeah, got it.
Given that it is a short session for the members and for the audience, we have already gotten, Sarah, correct me if I'm wrong, over 80 measures that we have either assigned to full committee at this juncture or subcommittees. We're anticipating another 20 plus. We had a docket meeting yesterday. A reminder for those in particular who weren't here at last week's organizational meeting, Sub 1 will be meeting today and next Tuesday immediately upon adjournment of full. Sub 2 will be meeting the next 2 Thursdays immediately upon adjournment. The last full week that we would have on the docket, tentatively, well, he's not going to like what I'm about to say, tentatively, Sub 1 will not have that Tuesday to meet, but rather that will be a Sub 3 time if needed. Sub 3 is not meeting this evening, tomorrow evening, but they will be planning to meet probably the next 2 Wednesday evenings, along with hopefully having 1 Tuesday morning meeting. That is the glide pattern we're going to have to be on in order to complete the committee's work within the current time allotted and not have to have an extra committee meeting. So with that as a general general form of announcement to all the committee and those in the audience as well. General announcements first. If you're here this morning interested in House Bill 1483, Delegate Bell, with concurrence of the patron, that will not be heard this morning and will be assigned to Subcommittee 2. If you are here in interest of House Bill 1533, Delegate Pope, that will also not be heard this morning and has been assigned to Subcommittee 1, and it will not be on Subcommittee 1's docket later this morning. So for 1533 would be on the docket for Sub 1 next Tuesday or later. So stay tuned on that. I have a measure that has just recently appeared in the system, House Bill 2304. That is a Medicaid reform measure. It is Sarah having done yeoman's work. I believe it has 13 enactment clauses on a bill that has 3 lines. It has not been assigned anywhere at this juncture, and it will not appear before next week on any docket to be heard either in full or sub. All that being said, if you have an interest in House Bill 2304, if you have concerns, see me. We're going to try as best as possible to resolve the questions around that matter in my office among the various stakeholders before we take up a lot of time within full or subcommittee. Staff, are you aware of any announcements otherwise I need to make? We have committee members an extensive docket this morning. I will also share as general announcement as well that through the process as subcommittees may be adopting recommendations for amendment nature of substitute. Once staff has gotten that information in a finalized fashion, it will be distributed to the committee members. If you recall, the past practice had been that I had asked staff to have them distributed paper form on the dais when the committee would meet, so members would have the time to review the substitute before actually adopting it. Heaven forbid we know when we're adopting. This manner will do it in an even earlier format, electronically available to the members when you pull up your docket for that given meeting. Correct, Sarah?
Anything that's reported on the
That is
subcommittee
a subcommittee substitute, yes. That it would not be available to the public at that juncture because it's part of working papers among the committee, unless the system does that anyway. You'll get to see it before you vote on it. What a thought. Okay. So we are also using the electronic sign-up, not the paper printed version. So Delegate Villanueva, who I do not see, is first on the list. Boom. Delegate Greason, you the man. Committee members who have signed up electronically, we will still always take you after non-committee patrons who have appeared. Good morning, Delegate Greason.
Good morning, Mr. Chairman, members of the committee. I love coming to hang out with you guys, so happy to be here today. I am talking to you about House Bill 1467. If the members could bring their attention, you'll see it's a very, very simple bill that would basically require that the Board of Health shall adopt regulations to include neonatal abstinence syndrome on the list of diseases that shall be required to be reported in accordance with that particular code section. We've got some experts, Mr. Chairman. I'm sure most people on this committee are more familiar and expert, like potentially Delegate Garrett, Delegate Stolle, Delegate O'Bannon, on neonatal abstinence syndrome. But it is becoming quite a topic of concern, and having the information associated with the number of cases, the reporting statistics, how many instances there are in the Commonwealth, we thought it might be a good idea to go ahead and start reporting on that, and so we can understand the magnitude of the situation. But that's all the bill does. You'll notice in the bill it does not say that someone in the department will then get that data, will evaluate the data, will pick up the phone and call the family who has the child potentially with NAS. It does not say that the department will create an action plan to help mitigate the problems and or give counseling to solve the problem. Those are all interesting and valid points, but that's not what this bill does. All this bill does is say we should collect the data and report on it. And Mr. Chairman, I might suggest to the members of the committee, there was an impact statement that came out very late in the process, I think I got it last night, that basically says there's $250,000 plus over the course of a number of years, plus hiring 2 new people to do all these grand and wonderful things. But again, the bill does not say the department has to do any of those things. So Mr. Chairman, I've given you the depth of my knowledge on this bill and what we're trying to accomplish. I think it's great. There's a lot of people here who can stand up and talk more readily about neonatal abstinence syndrome. But that's my story, Mr. Chairman. I'm happy to take any questions.
Any questions from the committee members? Delegate Greason, I don't have record of fiscal impact on this, but I have heard little birdies chirping that.
Well, Mr. Chairman, I don't have record of that either. So
You just kind of alluded to
would you like to see it, Mr. Chairman? I'd be happy to.
$250,000 cost at some future juncture.
Yeah, Mr. Chairman, if I might, I do have the impact statement here. Certainly don't want to hide the ball on anybody. In 2018, there's a $52,000 impact designated to setting up and altering the website associated with the reporting mechanism. So there's some setup costs, one time $52,000 to set up the procedure to capture the information and deliver it on the web-based portal that's currently being used. Mr. Chairman, there's a $16,000 ongoing cost for IT support, server support, and web portal support. So $52,000 to set it up in 18, $16,000 ongoing maintenance in 19, 20, 21, and 22. And then, Mr. Chairman, there's a second piece of $128,000 annually for 2 positions that would be used to establish the program, analyze and report, manage the data, coordinate care, prevent activities related to NAS. The bill isn't asking the department to do any of those things. So I will share with this, and if you'd like, Mr. Chairman, I can hand you this if you need it.
And I guess the only other question is, I read the measure. There are already diseases that are required to be reported. All this measure would do is have them do regs to add a new type of reportable disease.
That's right, Mr. Chairman.
And so the follow-up, so I guess I'm puzzled how that, if other things already having to be reported, how does adding another name in the box have all these costs? All that being said, here's what I envision. Probably should have done this as a matter of announcement too. Bills that come straight to the full committee, it is with the chairman's anticipation, they won't be controversial. If they get that way, then I will promise on the first round, they won't die.
Oh, that's nice.
But rather they may go by for the week, or they may be reassigned to subcommittee. On this particular one, Tag, I don't have any problems with the policy, and I don't know if any members of the committee do either. There are some questions that filter to me about potential fiscal implication. And rather than today take a motion to report, if that would be the committee's wishes, and refer to appropriations, Tag, would you be amenable if we hear all the comment and testimony that you may have from presenters who come with this one with the expectation of being heard, and then we just defer action till Thursday until we get further clarification from the ninth floor of whether they feel it needs to come up there or not?
Mr. Chairman, that'd be fine
Would
with
you
me.
be fine? Okay.
Yes, sir.
Okay. Delegate Grist, do you have others to speak to the measure? Anyone in the audience to be heard on 1467, knowing we are not going to take definitive action this morning, but we would like to hear any particular opposition to the measure you might have. Because as I read the sense of the committee and no questions coming forward, I don't hear any opposition from the committee to the underlying policy. Tag, if you're fine.
Mr. Chairman, I'm fine, but to your point, and I don't want to trespass on your time, there was one individual who came to testify and might not be able to be back here on Thursday. Might I let that individual spend just a minute?
Yes,
Thank you,
sir,
Mr.
by all
Chairman.
means. And may measure coming forward, just understand, right now, we don't anticipate a problem with the policy. The only potential question, I think, in the mind of the committee might be the fiscal implications, and that's going to be an overriding concern of everything we consider in the current budgetary climate. So, but please.
And Mr. Chairman, certainly appreciate that. I will just act as introducer today. My name more about an issue that we hope you will consider.
Thank you, Carmen, appreciate it. Good morning, ma'am.
Good morning, and thank you very much for your time. As he said, I'm Dr. Barbara Snap. I'm a nurse practitioner. I live in Fredericksburg, Virginia. I work at Mary Washington Hospital. I've been in neonatology for already 35 years, and I've never seen anything like this. The babies that we see, just as the opiate crisis has come to the attention of you all in Virginia, we are seeing more and more an avalanche of these babies coming in. Just like their mothers are withdrawn from narcotics, as soon as they are born, these babies are withdrawn from narcotics. And they are miserable, miserable babies. They cry 24 hours a day. They can't eat. They are truly withdrawn, just like their mothers are, and without our intervention, they will suffer through this alone. They have parents who are also having issues, and without our help, we're concerned is that these babies will go home and withdraw at home without the tools and the resources that we can give them. What we need are the tools to know how many of these babies are there. Right now, we don't know that. We don't recognize these babies. They might go through the system and go home and then come into our emergency rooms having seizures, not eating, and failure to thrive. So that's why I'm here today to say these babies are important to us. These babies need our care, and we would like to have the tools so that we can take care of them. Thank you for your time.
Thank you, ma'am. Any questions? Thank you for service to the area, in particular, since that's my area. So. Wise choice, Dan.
Thank you, Mr. Chairman.
Mr. Chairman?
Yes, sir.
May I ask a quick question of the witness, please?
Yes, Delegate Levine.
Actually, a very simple question. I actually have met with your group and do a tremendous job. But how does this bill help you specifically?
Because it's not reportable and we don't know how many babies are out there. And without looking for them, without knowing that in this town, say in Southwest Virginia, even though the state numbers are perhaps 10 to 15, what if it's 20, what if it's 25? And we're not catching these babies. So in order for us to know how many are out there and know how many we should be having, so if I have a hospital with a delivery service of 3,000, 4,000, 5,000, I should be seeing so many of these babies, but I have a large delivery service and gee, I don't see any at all. Where do I get that information to say, you know what, I'm not doing the screening I need to, I'm not finding these babies.
Mr. Chairman, quick follow-up.
Delegate Levine.
Does this reporting, I mean, there obviously are differences among the Commonwealth. There are areas with more problems and less problems. Would this reporting mechanism also, I wouldn't just give a statewide number, it would do by region and things like that?
Yes.
Thank you.
Thank you.
And in furtherance, I would say this is all part of Secretary Hazel's presentation Thursday as part of the whole drug problem. And one of the flaws that he highlighted was the fact that we don't have the data to know the true magnitude of this piece of the problem. So that's what this is trying to achieve.
Yes, sir.
Thank you, Mr. Chairman.
So if there are no further questions, understanding with it, this will be on our docket for Thursday, and the presenter will not need to be back. And I promise that if anything goes south of that, we'll get you back here. We won't kill it without you here to watch us.
That sounds good. It's my favorite part. Yeah, thank you. Mr. Chairman, thank you very much.
So House Bill 1467 will go by for the day and be on the docket Thursday. Thank you, Ted.
Thank you, sir.
Has Delegate Villanueva appeared? Yes, we have no Pukas, yes. Right. Whenever he comes over, we'll take his measures. So otherwise, if there are no other patrons in the room, we will start then to committee members' bills that are on our docket. Unless there's objection, while we did use the electronic sign-up, you all are going to be here anyway. I'm just going to go through numerically. Delegate Farrell, are you ready to present?
Yes, sir.
In what order?
Mr. Chairman, and if we
House
might,
Bill 1451, would that be a good starting point?
it would, but if it's all right with you, Mr. Chairman, just on 1549, I talked to the department. There's a couple things we just want to straighten out. If we could just take that by for the day, I'd appreciate it.
1549, by for the day.
Thank you, sir.
All right, members, draw your attention, House Bill 1451.
Thank you, Mr. Chairman. Mr. Chairman, 1451 is a bill that came out of some experience on the Commission on Youth. I know Delegate Peace, who chairs the commission, was there with me. It was a day when we had a group of foster care folks who had been in our foster care program. They were adults now, they had aged out. And we were getting feedback from them on their experiences, and it occurred to some of us that we asked them, does anybody ever get feedback from you when you age out of the foster system, so we can understand kind of what your experience was, what we need to improve on, what worked, what didn't, and we don't do that in any way. So this simply is a Section 1 bill directing the Department of Social Services coordination of the Commission on Youth to develop that process and standardize a way to gather feedback from people as they age out. I know it sounds simple, it may get complicated, but that's why we're asking them to work together to come up with something.
And if I see correctly, Delegate Farrell, the physical impact statement says the department communicates they can do it within their existing resources.
Yes, sir, that is correct.
So there's no fiscal implications to the budget. Any questions on House Bill 1451? Anyone in the audience to be heard on the matter, either in support or opposition? I believe I see a lady coming forward. Delegate Villanueva, you're going to be next. Yes, ma'am. Good morning.
Good morning to you. I'm Alicia Smith from the Virginia Education Association. We are definitely in support of this bill. We do find it very important that these children, as you said, as the delegate said, are aging out, that we do capture this information.
Thank you, ma'am. Any questions? Ms. Smith, thank you. Yes, ma'am.
Good morning, Allison Gilbreth, Voices for Virginia's Children. Just wanted to state that we are in support of this bill.
All right, thank you. Are there others? Committee members, what is your pleasure on House Bill 1451? It's been moved properly seconded that we will report House Bill 1451. There's no further discussion. Members, record your vote on the electronic, our first one on the new system. John, there's
Let's push it twice.
Delegate O'Bannon is trying to push his button. There we go. All right. If all members voted here to be reported, Delegate Bogey, can you? Hey! Delegate Farrell, your bill is reported unanimously. I want you to know. Thank you. If you'll suspend, we'll come back to you in a moment. In the meantime, Delegate Villanueva, good morning. Sorry to keep you waiting a moment.
Mr. Chairman, sorry, I wanted to be here first. Sorry. Let's see.
You'll always be first in our hearts, Ron. That's okay.
Mr. Chairman, sorry for, I was...
House Bill 1688.
Mr. Chairman, House Bill 1688 deals with the ability to give chiropractors to provide physical examinations for commercial driver's licenses. As you recall, you've seen this bill in the past. At your direction, Mr. Chair, you asked the Board of Health Professions to review chiropractors' clinical training, specifically relating to CDL physicals. The Board of Health Professions, through an extensive study, unanimously found chiropractors are indeed trained to provide this service. This bill makes it clear chiropractors can provide the service. They meet the same requirements as doctors in medicine and all other providers who provide CDL physicals.
Well, would it be fair to say, Ron, that they used to be able to do this, then because of certain legal changes at the state and or federal level, it was brought into question. We had a little bit of a dogfight over the matter in the past session in particular. And in the intervening time, the Board of Health Professions has said, if they take the federal training, they should be able to give the CDL physicals.
Mr. Chairman, that is correct.
All right. And given that I don't see the usual line of suspects here in opposition.
Second.
Before the committee takes action, is there anyone in the audience to be heard on House Bill 1688? Hearing none, the motion is to report without amendment. Members, record your vote on the board. Push the button gently once. In the center, I have been about. Delegate Bogey. There we go. Delegate Farrell. All righty. You got her.
Number 2.
22 to nothing. Boom. You try harder. We heard that from Ace. But anyway, okay. All righty, Delegate Farrell, back to you.
Thank you, Mr. Chairman. Mr. Chairman, on 1551, there is a substitute.
All righty. If staff could distribute substitute for House Bill 1551 before the committee takes action, Delegate Farrell, could you tell us the differences between the original version and the substitute?
Well, I would say it this way, Mr. Chairman. The substitute is language worked on with the Supreme Court to make sure the court system and the department were singing from the same tune, quite frankly, to make sure we do this correctly.
So there's no substantive change, it's just procedural changes?
I would say it's more of a language change, structural change to the bill, not substantive. We're still going to be doing the same thing. Mr. Chairman, what this is this comes from the Deeds Commission, which has been working on mental health, and a couple of folks on this committee also serve on that with me. This bill comes from the sub work group within that committee. It's the structure work group with Chairman Deeds and Chairman Hanger, myself, and we realized we really don't have a lot of good data in a lot of places, quite frankly. When you're trying to reform a system, data tends to be helpful and necessary. So what this does is following all laws, privacy laws, federal and state, but it does allow for data sharing of mental health instances in our court system to be compiled and studied, quite frankly. And we viewed it as a necessary step to get the data and records we need to keep reforming the system. And it's a compromise, the language is a compromise between folks, the mental health stakeholders, and the Supreme Court.
So we have things in the proper posture. Does the committee and general consensus adopt the amendment nature substitute 1551 without objection? The substitute is now properly before us. Delegate Farrell, I will also say that, albeit second hand, I understand this matter has some questions about its fiscal implications.
I'm fine with it going upstairs.
Okay, I was going to say, we'll give you the option if
Absolutely.
the delegate agrees, we can hold it till Thursday, or we can entertain a motion to report and refer to appropriations.
Mr. Chairman, the chairman of appropriations has been almost at every single one of the Deeds Commission meetings. I'm fine sitting upstairs.
Anyone in the audience to be heard on House Bill 1551, amendment nature substitute before the committee takes action? Discussion from the committee. What is your pleasure?
Move to report and refer.
It's been moved that we would report House Bill 1551 and refer to House Appropriations. There's no further discussion on that motion. Members record your vote on the motion to report and refer as amendment nature substitute. Delegate Helsel. All right. Bill is reported and referred to appropriations 22 to nothing. Thank you, Delegate Farrell. Have you another bill?
Thank you, Mr. Chair. With the bill going by for the day,
That's it. All righty. Delegate Garrett, I see you're next numerically, House Bill 1505.
Thank you, Mr. Chairman. Draw the committee's attention to House Bill 1505. And let me just quickly set the stage for this, because I didn't understand this until I delved into it. Currently in the state of Virginia, Mr. Chairman, for the members of the committee, anytime you want to purchase a grave or gravesite or an above-ground crypt or niche, 10% of your purchase price is placed into a perpetual care trust fund. As you all know, in the Commonwealth of Virginia, all cemeteries are kept in perpetuity. Under the current code, that the only monies that can be distributed from that trust fund for upkeep of that cemetery are the interest and so forth that accrues to that. You cannot spend any of that principal. That's been a challenge, obviously, with these lingering recessionary pressures. So what the bill does, Mr. Chairman, is it establishes an additional pathway whereby the trustees can choose to distribute those resources, and it creates what we are calling a total return distribution method. And effectively what that says is, based on the last year's market value of that fund, the trustee would be allowed to distribute up to 5% of those resources for maintenance of the graves. That's, in short, what it does. I'd be happy to elaborate if there's any questions. I know
Any questions of the patron on House Bill 1505? Anyone in the audience care to testify or have comments on 1505 before the committee takes action? Yes, we have no notice. This needs to go upstairs. So, committee members, what is your pleasure?
Second.
Slowly, we're getting there. Yeah. It's been moved, properly seconded, that we report House Bill 1505. No further discussion from the committee. Members record your vote on the motion to report. Delegate Edmonds, do you care to be reported? There we go. The bill is reported. 22 to nothing. Thank you, Delegate Garrett. Do you have another?
I do, Mr. Chairman. Mr. Chairman, members of the committee, I draw your attention to House Bill 1610. This basically, Mr. Chairman, is built on work that the General Assembly passed in 2014, which allowed an expedited process whereby the Department of Forensic Science, in conjunction with the Board of Pharmacy, can schedule these very dangerous bioorganic chemicals that just show up on the streets to harm our children. They can schedule those in the off session, when we are out of session, And then there is a duty of the General Assembly once, in essence, once it's back in session, within 18 months of that scheduling of these chemicals by the Board of Pharmacy, we have to then affirm that that scheduling process is just. Mr. Chairman, since we last adjourned, there have been 28 chemicals that have been added to Schedule 1 of our Drug Control Act. There are 7 new opiates, 9 new hallucinogenics, 2 new depressants, 2 new stimulants, and 8 new cannabinoid agents, Mr. Chairman. So just as in the last 2 sessions where we've had to affirm that in fact these chemicals need to be Schedule 1, which I remind the members means essentially that those drugs have no medicinal value, having a high abusive potential and a high addictive potential. And so I offer this legislation for your consideration, Mr. Chairman. And I do appreciate folks at BFS and the Board of Pharmacy and all the great work they do to keep these chemicals away from my children, as well as
the
the rest of
the
the
staff has a suggested amendment.
And there are amendments, I
For
appreciate
those
it.
presented in general, the premise behind this bill is to allow our agencies to respond to new drugs that may be developed and come out there available to the public, to try and rein them in and protect the public safety in a more timely manner than our previous practice of just doing it every year when we get here with our usual cleanup bill.
With your usual impressions, yes, sir, Mr. Chairman. And there are some line amendments that are technical in nature, Mr. Chairman.
All right, Sarah, if you would, committee members, give your attention to the line amendments.
Okay, there are 5 line amendments. Some of these are drug names, so bear with me as I try to say these. Your first line amendment is on page 3. No, I'm sorry, page 4. Line 194. After the end of that name, but before the closed parens, we're going to insert comma 2, capital C, dash capital I, dash capital NBOM, lowercase e. Your next amendment, page 4, line 208. At the end of that line, before the closed parens, insert comma 25C. Amendment 3, line 210, end of the line, but before the closed parens, insert comma 25B. Amendment number 4 is on page 6, line 351. At the end of that line, after the XLR11, insert comma 5-fluoro-UR-144. And your last line amendment is on line 353. After AKB48, insert comma, all capitals, APINACA. And that is all.
Mr. Chairman, I would just offer those amendments are technical, quite technical in nature.
The objection, absent substantive objection, we will adopt those by WR's consensus.
Without objection, those amendments are adopted. My apologies, it was a matter that's going to be on our docket in just a moment. We need some clarification on, so I apologize. Anyone in the audience to be heard on House Bill 1610, or committee may take a motion to whatever may be as amended. Committee members, what is your pleasure?
Second.
Moved to seconded to report as amended House Bill 1610. There's no further discussion, no testimony from the public. Members of the court to vote on the board on the motion to report. All members have now voted. Bill is reported 22-0. All right. Thank you, Delegate Garrett. And then moving down, let's see. You have another? Whoa, you are pushing your luck. Go ahead. House Bill 1767.
Thank you, Mr. Chairman, and also have some, again, technical line amendments for these. Easier to pronounce.
There are 5 line amendments to this bill as well. Your first line amendment, page 2, line 83. After dentistry, insert comma, optometry, comma. Amendment 2, also page 2, line 83. After veterinary medicine, insert comma, a nurse practitioner, comma, or a physician assistant. Amendment 3, page 3, line 140, after dentistry, insert optometry, comma, optometry, comma. Amendment 4, page 3, line 141, after veterinary medicine, insert, comma, licensed nurse practitioner, comma, or licensed physician assistant. And amendment number 5, page 3, line 171, after controlled substances, insert strike, to possess and administer Schedule 2 through 6 controlled substances.
Everybody hear the amendments? Have any questions about them? If not, we'll adopt them in a block by general consensus. Hearing none, the amendments are now properly attached to before us. Delegate Garrett.
Thank you, Mr. Chairman. Mr. Chairman, members of the committee, this work builds on two parallel paths that have been occurring concurrently. One is through the SJ 47, the Deeds Commission, and the work that I chair in a task force dealing with crisis response and emergency services. And one of the primary efforts that we've undertaken is to try to figure out how we can improve access to telepsychiatry, the provision of psychiatric services from a distance, particularly in those underserved areas of our state as one element of our efforts to address the inequity in access to care. The separate parallel path is actually on the Senate side, Senator Donovan working with, I know Scott Johnson was very integral at the federal level, trying to figure out how we can integrate this process. Mr. Chairman, members of the committee, as you know, currently in the Code of Virginia, it requires a person-to-person physical interaction between a physician and a patient to effectively establish that relationship. And that is on its face, you simply can't accomplish that if you're practicing telemedicine, which is the provision of these services by consultation, audiovisual connectivity, and so forth from a distance. So with that, Mr. Chairman, what this bill basically does is it says that it expands the definition of that physician-patient relationship to allow the use of instrumentation and diagnostic equipment through images and medical records that may be transmitted electronically as long as it is in compliance with federal regulations for the practice of telemedicine. Second thing is it does is it also grants the capacity for community service boards to facilitate the access to medicines that might come from those consultations in the communities. That's in short what the legislation does, Mr. Chairman. Members of the committee, I'm not aware of any opposition to this.
All right, as many members have heard the explanation of House Bill 1767, is anyone in the audience to be heard on the matter before the committee takes action? Yes, ma'am. Good morning.
Mr. Chairman, members of the committee, Jennifer Faison, I'm the Executive Director of the Virginia Association of Community Services Boards. I just wanted to applaud the work of both the SJ 47 Subcommittee and Senator Donovan's parallel process on this bill, and wanted to let the members of the committee know that we very much support it. Thank you.
Thank you, Ms. Faison. Anyone else to be heard on the matter? Questions from the committee members? What is your pleasure?
Second.
Moved and properly seconded, the report as amended. And for full disclosure, Sarah has advised me that the amendments we did as a block, that there were two we adopted that don't need to be heard. So by general consensus, we'll kind of unadopt those, if that makes sense, without objection. These are just technical changes because they were already encompassed in the map. All righty?
Motion, Mr. Chairman.
Robert, slow the train, I'm sorry.
Mr. Chairman, Scott Johnson for the
Mr. Johnson, good morning.
Good morning, sir. Sarah, on amendments 3 and 4, and all of these came from health professions, those were deletions as opposed to insertions.
I'm sorry, I don't know.
So you're basically moving the same language in the bill and not changing anything other than the location. So
Never mind. Okay. Thank you, Scott. Keeping us straight.
Thank you, Mr. Johnson.
All right. Members understand what we're doing? Could they explain it to me? No. Everybody understands the amendments now that we've already adopted and full impact. So the motion is to report with amendments. Members record your vote on the board. All members voted. Those reported 22-0. Thank you. Delegate Farrell, I believe you wanted us to revisit a matter. You had a motion.
Am I allowed to do it on my own?
Yes, you may.
On the 1551, which we reported and referred to appropriations, I would really appreciate if the committee would just
Have Having voted on the prevailing side, whereby we reported.
Which report referred, I move that we would reconsider that motion.
Delegate Farrell moves that we reconsider said vote. So the matter is back before us if we agree. All those in favor of reconsideration, say aye.
Aye.
The bill is now before us, and I believe, speaking for Delegate Farrell, he would ask that we let that matter go by for the day. We will not have another rehearing on Thursday, but similar to a couple other matters, there's some question between us and the ninth floor as to how much real fiscal impact some of these matters are having.
Thank you, Mr. Chairman.
All right, so that matter's just by for the day. We'll not have a rehearing on Thursday unless some new information has come before us. Delegate Robinson, are you ready? Good morning.
Good morning, Mr. Chairman, members of the committee.
House Bill 1541.
House Bill 1541 is kind of a housekeeping bill brought to me by the Board of Health Professions. If you look at what the bill actually does, is it adds 2 words to the statute in line 5 of the bill, that I withdraw approval from education or training programs for failure to meet prescribed standards. The or training is added because if you go down to line 55 in the bill, approved training programs for medication aids to include requirements for instructional.
So this is largely just a technical matter to
It's a
clear up.
technical matter because right now the Board of Nursing doesn't feel like they would have their ability to withdraw if the accreditation isn't there for that particular training for some medication aids.
Move the report.
Any questions from the patron on House Bill 1541? Anyone in the audience to be heard on the matter before the committee takes action? We have a motion to report. Is there a second? Seconded. There's no further discussion. All members record your vote on the board on the motion to report without amendment. We'll wait, Delegate. It's okay. Bill is reported, 22 to nothing. Delegate O'Bannon.
Thank you, Mr. Chairman. I have House Bill 1751 on the docket. This bill relates to our Virginia Foundation for Healthy Youth. This bill is a recommendation of your Healthcare Commission, and what it basically does is provides for that foundation to also undertake substance abuse and substance use prevention as one of its job obligations. This started in the beginning with youth tobacco. It's expanded to childhood obesity, and there is no fiscal impact with this. They will do this within their scope, and Governor Garrett and I will serve on that. So I would hope that we would approve this.
So this gives them a slightly broader mission within the resource base they have to work. Anyone in the audience to be heard on House Bill 1751? Good morning.
Good morning. Good morning, Keenan Caldwell, representing Community Coalitions of Virginia. They are a statewide substance abuse youth prevention coalition. It's about 26 of them, ground level, on the front lines of fighting youth substance abuse. And they look forward and welcome the opportunity to partner with the Foundation for Healthy Youth to address this very serious matter.
Any questions, Mr. Caldwell? Thank you. Anyone else to be heard on the matter? Questions of the patron? Committee members, what is your pleasure?
Second.
Move seconded to report House Bill 1751. If there's no further discussion on the matter, members record your vote on the board. Delegate Garrett. Bill is reported 22 to nothing.
Thank you.
All right. Delegate O'Bannon, we got another or no?
Yes, it is. Okay, my bad. Delegate Hodges.
Delegate Hodges, we ready? 1775.
Yes, sir. Thank you, Mr. Chairman. House Bill 1775 is fairly straightforward as it amends the definition of developmental services to replace intellectual disability with developmental disabilities. And if you look on line 158, where we have the definition of developmental disabilities, which was adopted, I believe, in the 2015 session, it is an umbrella term that includes intellectual disability and other physical disabilities. So basically, it also updates language to be consistent with federal disabilities terminology, and it also supports BBHDS and DMAS's efforts to have a single diagnostic eligibility criterion for all Medicaid home and community-based waivers for persons with developmental disabilities, inclusive of those with intellectual disability. I know there are a number of stakeholders supportive of this measure. I'm not aware of any opposition. And I believe Mr. Frank is here from the department. If there are any questions.
House Bill 1775 is before the committee. Any questions of the patron?
Mr. Chairman?
Yes.
I'm just curious, about 4 or 5 years ago, I had a simple little bill, I just wanted to change 2 words in the Code of Virginia, and my bill ended up to be 58,000 lines long, and I took out mentally retarded and changed it with intellectual disability. I'm just curious how you got by with only having a couple of pages, when mine was 58,000 lines long.
I think the answer is he's more efficient.
Thank you, Mr. Chairman.
Anyone in the audience to be heard on House Bill 1775 before the committee takes action? Committee members, what is your pleasure?
Mr. Chair.
Yes, sir.
Just go by for 3 minutes. We just did a crime commission thing on something and just realized I want to make sure we're not messing something up that's coming with another bill.
All right, without objection, the matter will just go by temporarily. We'll take it back up before the committee rises. All righty. Let's see, Delegate Hodges. Oh, my bad. Delegate Dickey Bell.
Thank you, Mr. Chairman.
Oh, there were 2.
House Bill 1795 requires that all home studies by local boards shall be conducted in accordance with the Mutual Family Assessment Home Study Template and any addenda thereto developed by the Department of Social Services. This is a recommendation from the Virginia Commission on Youth's Advisory Group, Virginia's home study adoption process. The advisory group was comprised of 15 participants, subject matter experts including juvenile court judges, adoption and foster care private agency representatives, attorneys, guardian ad litems, and parents. The advisory group participants assisted in the commission formulating recommendations for the study. A home study is required by the Code of Virginia prior to the approval of any family for placement of a child in a foster home or for adoption. The Code of Virginia also requires that every local board or licensed child placing agency that places a child in a foster home shall maintain supervision over such home. Home studies in Virginia are child-specific for adoption. An addendum is necessary if a provider has completed a home study to be a foster, resource, or respite family, but not for a child-specific adoption. For that reason, House Bill 1795 would require that local departments use any mutual assessment addenda thereto developed by the Department of Social Services when necessary. Mr. Chairman, I think there are folks here who can help us answer any questions that might...
So the long and the short, we want to make sure that whenever a home study is done anywhere in the Commonwealth, we're all using the same criteria.
Exactly.
So have uniformity and protections afforded universally among agencies. Yeah. All right, any questions of the patron on House Bill 1795? Anyone in the audience to be heard on the matter in support or opposition?
Allison Gilbreth, Voices for Virginia's Children. Voices have the pleasure to serve on this advisory committee, and we are in support of this legislation.
All right. Are there others to be heard on the matter? Committee members, do you have any amendments, questions? If not, do I hear a motion? Right. Then moved properly seconded to report House Bill 1795. Members record your vote on the electronic board. Yost and Hodges were missing votes. Be careful to report. Delegate Hodges is coming. Matters reported, 22-0. All righty. Committee members, I believe we'll come back to Delegate Hodges in a moment. I have a few little matters before us. If we can take up House Bill 1474, and I will be turning the chair over to my Vice Chair, Delegate O'Bannon, please, to preside.
Thank you. So members, please turn your attention to House Bill 1474 from Delegate Orrock.
Committee members, 1474 simply makes modifications to the original remote supervision for dental hygienists to broaden the types of facilities in which the hygienist may practice under remote supervision and give some additional protocols for hygienists to treat medically compromised patients and those with periodontal disease. not aware of any opposition on the measure, but I will welcome any questions and have folks here representing the industry who can provide more information if needed.
All right, thank you, sir. Any members have questions or comments? Any public testimony? Move the report. All right, all on board?
All aboard.
Thank you. Clerk, please close the roll. Bills reported 22-0.
Thank you, Mr. Chairman. May we take up House Bill 1567?
All right.
Mr. Chairman, members of the committee, House Bill 1567 will simply make a minor change to the current Medicaid application process that would now also include at the time an applicant comes in to see if they're eligible, that they would be provided information about how to enter into advanced directive instruments. It does not change the current voluntary nature of those directives. It's totally patient-driven communication, but this just makes them aware of how they can exercise their right to do so if they so choose.
All right. Any committee members have questions or comments? Public testimony? Committee, what's your pleasure? Second. All right. Motion to report 1567. The roll be open. Hodges and Bell. Vote.
Y'all vote aye.
Yes, that's specific. All right. 22-0. The bill's reported. Doug, all right.
Thank you, Mr. Chairman. If members could turn their attention to House Bill 1568. And as they do so, Mr. Chairman, members of the committee, and to give a little historical background, as the committee may recall, for the past 2 years in particular, I think I have been the dam, as it were, preventing social service efforts to expand the population of individuals that are required to undergo the fingerprint background check for child daycare providers. The reason I have been the dam heretofore has been that we, as a matter of public policy, have specifically exempted certain entities that were not licensed by the department, but rather were just registered. The distinction being that licensure brought with it certain requirements those facilities had to meet, that the Department of Social Services oversaw the compliance of, versus registration. Because they were exempt, we said, you're exempt from the state coming in, but we want to know where you are. And that was pretty much all that registration required, was these entities would tell social services, we're here, and we look after kids. And that was the public policy we as a body politic within the legislature have embraced. The reason we're here today is the federal government, through regulation, not through statute, and then through further interpretation of said regulation, have pretty much said, if your state is taking federal monies for any licensed or registered child daycare entities, then all, whether you have made them exempt or not, and whether those facilities are actually getting any federal monies or not, all of them must undergo fingerprint background checks by October 1st of this year, or it puts in jeopardy your entire block grant monies from the federal government, and there is a specific statutory penalty minimum of 5% of the block grant allocation to the state. We've heard dollar amounts all over the map, Everything, the most common number I've seen and kind of used has been 17 million. The total block grant is over 50 million, I believe, or bigger. I'm getting signs over here. But at the very least, 5% of that allocation from last year would be north of, I believe, 5 million, or somewhere in that range, 3 to 5 million. So long and the short, members of the committee, I'm here with this bill as a pledge to social services last year that because the federal government is figuratively holding a dollar gun to our head, that we will lose federal monies. And it is only for that reason that I come forward today with this bill that would then make all licensed or registered daycare providers, whether acting as paid or volunteers in said facilities, have to undergo a state police administered federal fingerprint background check. I would propose to the committee some amendments, and I would ask, I'll read them to you. The first, with these are enactment clauses, that we would add an enactment 4, that the provisions of this act shall expire July 1, 2018, a 1-year sunset. And secondly, and this one is lengthy in its language, and Sarah, if you would distribute the copies, in the meantime I'll be explaining them. But the other enactment language that you'll have distributed to you in a moment will stipulate, and even if before July 1 of 2018, federal regulations or their interpretation change, and we have communications from the federal government that we don't have to fingerprint everybody, then the Virginia DSS will immediately cease requiring further background checks beyond what the federal laws regulations will require. That is the long and the short of those two amendments, Mr. Chairman, and I would ask for the committee's favorable consideration of them.
All right, committee, do you have any amendments? Any questions? Second. Second. All right, that's a motion properly seconded, and Delegate Pope.
Yeah, my question would be, in the original federal language, what was the date certain that states had to come into compliance?
October 1, 2017.
Thank you.
Okay, any other questions? All right, we have a motion properly seconded to adopt the amendments offered by the patron and chairman of this committee. All in favor? Aye. Any opposition? Okay, the bill as amended is before us.
And Mr. Chairman, there is still some opposition, and rightly so. I know folks in particular within the current exempt religious daycare facility exemptions feel that this is still an overreach of the federal government for full disclosure. I must say I concur that it is the interpretation from individuals within the federal government that has to administer these programs. Based on their interpretation of the regulation language, they have taken a very broad interpretation, and they state that in their opinion. That being said, the reality is, if we do not pass this legislation this year, Virginia will be out of compliance with the federal regulations as they currently exist, and the net result would be at least a minimal, I've been advised, somewhere $2 to $3 million reduction in funds to the Virginia Child Care Block Grant funds to the Commonwealth. For full disclosure as well, and to everyone here, I have received information secondhand this morning that appropriations has concerns. And rather than have this bill at this juncture reported and referred to appropriations if the committee so chose, I'm going to ask that the committee not take action, but rather the committee would still go ahead and hear the matter today. I particularly wanted to get the amendments attached to the matter so all stakeholders would understand the language going forward. It would be my hope, because I understand that the challenges that appropriations have concerns over is when you expand state police requirement to do background checks, it costs the state police money. I still am puzzled why appropriations needs to see that, because the state's not going to pay any of the cost of these background checks, but rather, and that's part of the church's opposition, it will attach to the provider or the entity entire group, the church will have to pay the money, or the individual who is having the background check done on them will have to pay the money. So the state police are gonna get more money as they do more background checks, because that's how the law's written. So that's kind of the long and the short, but I'll defer to the committee's will on that.
All right, thank you, Mr. Chairman. Delegate Head has the floor.
Thank you, Mr. Chairman. I don't know if anybody's able to answer this question or not, that's here today, but is this the kind of thing that if we were to not pass this, that if this was viewed to be an overreach, which I clearly think that it is, and based on everything that you've said, appears really to be way out of step with where they ought to be going, is this the kind of thing that could be litigated? Not that I'm trying to be litigious, but I mean, I'm just wondering if that's the kind of thing, there could be some court action that would say, no, you're not going to do that, you've gone too far.
Mr. Chairman, if I may, to try and respond, I'm not aware of any pending legal challenges to the federal interpretation. However, I would say, because of the very issue you have raised, not so much the litigation, but the fact that things in Washington, I think most everybody in the world is about to change somewhat. Their definition of somewhat may differ, but that being said, with the amendments we've adopted on this bill, it means that if anything changes between now and July 1, when this bill would take effect, to where the currently exempt child care entities under Virginia law were no longer drawn into this web by the federal language, then as of July 1, they would not have to change anything from where they are. And that was the very purpose of those amendments put on there. The feds lower the bar, we're immediately going to the lower bar and not going to have something more restrictive on our child care industry than what the federal government requires.
All right, so I think where we are, the posture is that we have a bill that's been amended and it's before the committee. The patron has requested that we go ahead and hear the bill today, take comment, and take no act, and then pass it back to the day, and we will act on it in full committee on Thursday. And so we now have opportunity for either further comment from the committee or from the public. So. Come forward, identify yourself.
Good morning, members of the committee. My name is Emily Griffey. I'm with Voices for Virginia's Children, and we believe that children deserve to be safe in childcare. You've heard this measure for the last 2 years, and you've heard the story of Ellie Lafkin. She's a mom from Shenandoah who did a name-based background check on her child care provider. It came back clean. When her daughter was in the care of this provider and unfortunately passed away at 12 weeks old. When they ran her fingerprints, she had given 5 different aliases based on the name-based background check. This is why we need fingerprint checks. Our volunteers in public schools, our scout leaders are all expected to have some sort of fingerprint check. Those who are in the business of providing child care should have this check as well. And not only will you be in compliance, you'll be keeping our children safe. I hope that the Senate Rehab Social Services Committee passed this measure out last Friday. They heard that the religious exempt community actually receives over $22 million of this federal block grant. It is to help low-income moms who are working or in school over 30 hours a week to afford child care. This measure is needed to keep children safe and to ensure that mothers can work and contribute to our workforce and our economy. Thank you very much.
Thank you, ma'am.
Hi, I'm Charlene Vinson. I'm the Director of Children's Licensing at the Department of Social Services, and I'm here to say that the administration supports this bill.
Thank you. Welcome.
Good morning, Mr. Chairman and members of the committee. Thank you. I'm Dan Zacharias, Director of ODAX, and the daycares in our ministries operate with the religious exemption and licensure. First of all, I want to thank Delegate Orrock for adding the sunset clause and the proposed amendments that he has added. I do want to talk about safety briefly. There was an article that appeared in the Richmond Times, December 20th, 2014, entitled "Children in Unlicensed Daycares Are 5 Times More Likely to deny. The article cites the following data in support of its title. At least 51 children died in daycare facilities unregulated by Virginia in the past 10 years. That's the period 04 to 14. Compared with only 9 in daycare operations licensed and regulated by the Virginia Department of Social Services, according to agency data obtained through FOIA and on the website. Now, as I read that statement, or read that statement in the newspaper article, if I understand the term unregulated, as it's used in the article, and to be correct, and I believe it was, then 0 of those 51 children were in religious exempt daycares. Furthermore, the term licensed and regulated, if I understand that, it was of the 9, none, but I think there might have been 1, I looked really hard for that, might have been in a religious exempt daycare. The point is, our sector of this industry is not where the problem resides, and we feel like the discussion unfairly paints us as unsafe and dangerous when that's not the case. In the days leading up to this committee, Codex has distributed to members data gleaned from DSS data found online regarding child abuse occurring in out-of-family settings. The conclusion is that religious exempt centers are very safe, with a founded case of abuse being nearly 5 times less likely to occur in a religious exempt center than it is in a licensed center. That's not to say that licensed centers are unsafe. I think these instances are rare in both settings, but statistically, the point is religious exempt centers are very safe. Our first objection to House Bill 1568 is that it represents bureaucratic and executive overreach, as Delegate Orrock has stated so well. As a condition of the Federal Child Care and Development Block Grant, the bill places requirements on daycares not receiving federal money as a condition so that other daycares can receive federal money. Furthermore, the block grant places this General Assembly in the awkward position of having to approve a condition for federal funding after the funds have already been dispersed. Our second objection involves the safety issue. There is a genuine crisis in a particular sector of Virginia's child care industry. But it's not right to use that as a justification to exert new controls over a sector that's very safe. Now, if you have my written comments there, on my third to the last paragraph, I'm striking. I was going to talk about the disposition of the background check itself. I had some concerns, but someone friendly informed me that I was misunderstanding that, and so those concerns are completely alleviated. And so, furthermore, then we've requested amendments to the bill that would essentially remove only those religious exempt centers that do not receive the federal money. And we would request that the committee would consider those amendments, and if it's not the pleasure of the committee to do so, that the bill would not pass. I thank you for your time, Mr. Chairman.
Questions? All right, thank you.
My name is John Godfrey. I'm pastor of the Maine Baptist Church in Royal Grace Daycare Ministry in Clifton Ford, Virginia. After about a year and a half of prayer and preparation, which took us hiring an architectural firm to do a life safety plan on our building facility, we spent $30,000 upgrading our fire system, multiple doors, as well as bathroom facilities. Our daycare administrator went down to the Roanoke DSS office and informed them we'd like to register as a nonprofit or a religiously exempt, of which the supervisor in the DSS said, well, we'll let you do that this year. But understand, next year there will be no religious exempt daycares because there's a lot of changes coming. Which to me was shocking that a supervisor in the DSS in Roanoke, which I believe is really communicating the motivation from the DSS in Richmond. And I think that's the motivation of the fishing expedition that took place this summer. And I think that this bill is really just the tip of the iceberg. I believe it's the precursor to what is coming. And they do not like the fact that there are thousands of children who have the opportunity to go to institutions that they do not have control over. Now this bill, I believe, is a gross overreach. We are not the problem. There is not a problem here with religious exempt daycares, and this is not the solution. So if there's no problem and there's no solution here, then what this is another illustration of the tyranny of big government forcing upon its citizens unnecessary regulation, of which I think rural Virginia reacted to in the last election. I think America's tired of unnecessary regulation. What we're saying is this, is that we're going to, for 30 pieces of silver, regulate our citizens because we want federal funding. We don't use federal funding, and we're not part of the problem. And I would recommend to this committee that it strikes down this bill before they allow it to get on the floor where the power of public persuasion and a false facade of child safety is put forth. And our delegates have to make a choice between false or fake facade idea and conservative principles, which is living in government. Thank you.
Thank you, sir.
Eddie Ayler, Virginia Assembly Independent Baptist. I identify with both of the previous comments. I do cover a sector which overlaps slightly, but is broader than what ODAC covers and this gentleman. But this is important. We've got to begin to set the tone as to how we're going to be told what to do by the federal government. And if you can't do it now, you need to determine that we will do it going forward. Thank you.
Thank you.
Hi, my name is Grace Reeve, and I'm here on behalf of Child Care Aware Virginia. I didn't anticipate we were speaking today. Someone told me that people had already talked about this bill. It's been to the committee several times over the last couple of years, so I don't have remarks, but I would like to respond to some of the things that have said. There are 402,000 kids of working parents under the age of 6 in Virginia. This is the first time I've heard that the Appropriations Committee had concerns, so I did want to say something about that for a minute. No, I don't disagree. I just didn't know about it before, so I would have come prepared. But I did want to share with you what I know. We haven't been working with the chairman for 2 years. It's actually been 3. The first year that we came in, we tried to talk about the need for requirements so that parents could have a peace of mind when they leave their children in a child care setting. But we didn't have enough information, and the chairman worked with us to get a study so that there could be a review of the issues and the settings, and we could come up with a cost to it. And the review took place, and I think it was in December of 2014, a report was published, and that report said basically that this would raise money because there's a fee associated with the background check. So if you want to be a child care provider before you get that digital print, you pay your $45 or $50 or whatever it happens to be, and that's good for 5 years. So I will get you the cost estimate, but the imposition of a fingerprint check actually raises money through the fees that are charged on providers. These centers, child care centers, they make a choice if they want to pay. The way that it actually works is individuals who want to be in the business of providing child care pay that fee as a cost of doing business. So take the print, pay the fee, it gets processed, and maybe as a cost of doing business, they can deduct that on their taxes. I'm not really sure, but I can tell you there's a fee imposed, and the idea of that is to cover the costs involved in the processing of the prints. And so I will go back and get the cost estimate, but that report that came out showed that this is actually a revenue raiser. It doesn't lose money. Second, we are happy to work with the chairman on this bill. Any progress that we can make to ensure that children are safe in child care is good. This isn't about religion. It's not about, to us, regulation. What it's about is, I wish that all people who went into the business of providing care for kids did it because they love kids, and that's their vocation, that's their calling. That's what I wish. But what we've seen in several cases is that bad things have happened, and they were preventable. Emily Griffey from Voices for Virginia's Children talked about Ellie Lafkin. Ellie Lafkin has been here 1 million times over the last 2 years to tell her story. She had a 3-month-old baby. There was a name search conducted. when her baby died in childcare and the police did an investigation, they saw that this woman had 5 aliases, different names, long criminal history. In fact, this woman was on felony probation at the time that Cami Latkin died. If the parents had known of her history, they wouldn't have chosen her. But the fact is, because it was a name search and not a fingerprint search, they just didn't know. I also heard from the religious exempt community, and they offer some of the best care in the state. They really do. So this is not about any sector. But I will tell you that sometimes some things can happen. And what can we do to try and preempt that? Because a family whose baby died doesn't get a second chance. We are working with families throughout the state whose children have died in childcare because they're committed to childcare safety and they want to make sure that what happened to their families doesn't happen to anybody else's family. In Virginia Beach, in a religious childcare that was exempt from licensing, there was a baby died. His name was Dylan Cummings. He was 6 weeks old. He died in basically the investigation following the death of this baby found that there were 10 babies in a storage closet. So when the fire marshal came in to do an inspection, they didn't label it as a classroom or an infant room or a toddler room. They labeled it as a utility closet. But there were 10 cribs stuffed in that room. And it was hot and stuffy, and the staff were exempt from, training, so they didn't know that the American Academy of Pediatrics recommends that babies be put to sleep on their backs. So the untrained staff, in a room stuffed with 10 cribs, with poor circulation, put the baby on his tummy, and he suffocated and died. And when that case went to court, the judge said, look, I'm sorry, my heart breaks for you, this is a tragedy. But there were no violations here. There's nothing applies. What happened in this situation is a tragedy, but it's up to the General Assembly to decide what rules are going to be in place. So no rules here have been broken. So that doesn't mean that every religious facility may make that same kind of mistake. But what we're talking about is 402,000 kids under age 6 with working parents in the state of Virginia, who every week are in some type of childcare. How can we look out for working parents? How can we make sure that those kids are safe? And a background check is the very first thing, because we can weed out those people with a criminal history who really don't belong in the business of caring for other people's children.
Thank you.
Thank you.
All right, Mr. Chairman, any other public comment? Any comment?
Mr. Chairman, just to wrap up, and the committee's been very generous with their time, and understand we're not going to have a rehearing on this. It'll be my intention Thursday. We're simply going to take action on the matter. That's why we're taking the time this morning. Let me just respond to the maintenance chair, members of the committee, to some of the testimony you've heard. First of all, let me start off. This is not about the public policy of the Commonwealth as to changing the current exemptions. We've got legislation coming on that. That's another matter for another day. In my 28 years in the legislature, I don't think I've ever brought before the Assembly a bill that I hope will pass that I personally don't like. I couldn't agree more with the gentleman who made mention, this is all about federal government overreach. That's why I have kicked and screamed and blocked anything going forward for the past 2 to 3 years. And we're down at the end of the game, and the federal government is holding a gun, figuratively, in the form of money to our head, and say that if you don't make these folks, who in my opinion aren't part of the problem, if you don't make these folks who largely aren't doing this for any kind of a profit, they're doing it as a service to their congregations and their greater community. They're doing this largely with volunteers who aren't making anything out of the deal because they love kids and want to serve their congregation and community. But now, because the federal government tells us in a broad interpretation of regs that were passed, that if you don't do it, if you don't make these folks who are volunteering now have to pony up $45 or whatever it may be out of their own pockets, or the church congregation is going to have to front that, then child care subsidies that people are otherwise entitled to are going to have to be reduced. By how much, we don't know. But that's the reality of where we are. The federal government has said clearly haven't done this by October 1st, you're going to lose some federal monies in your block grants, which have already been allocated. So now we've got to fix it in the next budget and backfill. I hate that. But I hate even more that the monies that are then available as subsidies to these programs so that they can afford to put their kids in child care are going to be taken away, putting more children in potential jeopardy because they won't have the supplements where they can afford to have their kids in daycare, being in a circumstance where they're going to be even more latchkey. Because at the end of the day, I think we all would agree, first and foremost, we are all here trying to do everything we possibly can to affect as safe an environment for all of our citizens, but kids in particular, as we possibly can. And we know that when kids are unsupervised with no parents, no adults, no one around, they're in the greatest potential danger they will ever know. And so with those Hobson choices before us, Mr. Chairman and members of the committee, I would say I put in the bill. I stand here in total support of those folks who spoke in opposition. I couldn't agree with them more. They're not the problem. But unfortunately, some folks across the Potomac, bureaucrats up there, think, yep, we've got to cast such a broad net because we're trying to catch elephants who are the problem. We're going to catch all the little gnats in the process. And we're going to use dollars to make the states have to knuckle under. When this matter comes up for a vote on Thursday, I don't begrudge anybody who votes against it, except do understand we have the Hobson's choice. We can side with these folks that philosophically I and many of you agree with, or lose monies that are then going to put kids in a position of not getting the child care that is a safer environment than being at home on their own. There's the choice before the committee when it comes up, Mr. Chairman. Thank you.
I want to personally thank the chairman. You know, this is a very, very challenging, difficult issue. And the discussion has been full-hearted, and I think everybody comes with sincerity. I will say I don't know that I've ever seen a more tightly drawn bill with sunset and provisions there. If we get some relief up the road, that we will be okay. So it is my anticipation that we will hopefully vote on this bill Thursday. It will not be discussed, but we'll take action on it Thursday. I want to personally thank the chairman for choosing to file it. Anyway, Brenda?
My question is if we would like the committee to discuss it, please discuss it today or Thursday before we take action.
Yeah. Now.
May I speak?
Surely.
My personal objections to this bill, and I repeat what the gentleman said because I stand in league with him, is that I think it is, there's not enough grounds to assume that if you place your child in a religious exempt daycare that they are in danger. And I also believe that, but the danger lies on the other side in removing the religious exemption, because I believe that that is the camel's nose under the tent. And once the religious exemption has been removed, in this case, where does it end? Because the next thing we do know, and I would assume, that children who are placed in a religious exempt daycare, and I for one would put my child there in every confidence, because I would assume that there would be some spiritual training in their young lives. And I believe that that would be the next step, that you must stop that. Now that we have authority, then we begin to increasingly see the federal government encroach into every issue and every aspect. I was a home daycare provider, and I also was a foster parent. I submitted to the background check as a foster parent. I did not have to do it as a home daycare provider. But one thing too that you must understand about congregations and people within congregations who place their children within their church to be tended to, have a belief that those other members of their congregation are family. And those families operate on love. And many times that love is not present in a for-profit daycare center. And so love is what binds us together as Christians as we choose churches and choose where to put our children. And so I believe that that confidence is very well placed. Myself being a Christian in placing my child or wanting to see my grandchildren placed in a religious exempt daycare center. So I have grave concerns about the federal government being involved in where we place our children and how they are being monitored and whether or not, and I know there's some confidence is that as well, and it is a balance, but my biggest concern would be the next step is what we can teach in those daycare centers now that the federal religious exemption has been removed, and I think that's a slippery slope.
Thank you, Ms. Bogey. Delegate Farrell.
Thank you, Mr. Chairman. Can one of you three gentlemen come up here, please? So, just very quickly, essentially, I guess you're asking us, and I sort of philosophically agree with you, but what you're saying is this issue is bigger than the money, so give up the money.
That's correct.
Okay. For all the kids that otherwise wouldn't go to daycare.
I believe the danger
Outweighs
the overreach outweighs that.
All right, I just wanted to make sure we were all on the same page.
Yeah, I'm not acknowledging that there's not a negative consequence to our request, but I see the overreach as a bigger danger down the road, and Delegate Kogi stated it well. I do believe that there are people who would like the religious exemption to go away, and if that does happen down the road, children will not be safe.
Well, Mr. Chair, I don't.
Come to the chair.
Mr. Chair,
Delegate Farrell.
I don't disagree with that point, but what it really comes down to is you're saying don't take the money in this scenario because of this instance.
That's precisely
All right, I just want to make sure we're all on the same page. Thank you, Mr. Chairman.
All right, anybody else?
Mr.
Delegate Garrett.
Just very briefly, Mr. Chairman, there's plenty of things that we choose not to take federal money for if we believe in substantive and policy. Can somebody from DSS or Skip or somebody, if y'all can send me, and frankly send it to our clerks and get it to all of us, what we're predicating this decision on. And I'm sure you got some white paper and some elements of that, and I take for face value that it is what it is, but there's going to be a lot of changes, I think, that are going to happen before October the 1st. And I absolutely respect the chairman's, if there's anybody that could stand before us and speak to this issue more eloquently or with a greater conviction in his own understanding and belief, I don't know who it is. So if y'all could get that information, frankly, to us, I would appreciate that. Thank you.
All right, anybody else? So that concludes discussion of this bill, and as stated, we will vote on this bill Thursday. Back to you, Mr.
Thank you, Mr. Vice Chairman. Just to let the audience and the committee know as well, that the only thing we would hear on this matter on Thursday would be if we have any new information, such as Delegate Garrett might have suggested, the specificity of dollars that are involved, things of that nature. Or we would hear from individuals either in opposition or support who are not able to be here today and may have new information to share with us. Delegate Hodges, we have gone by on yours temporarily. What is your pleasure?
If we could go by for the day, Mr. Chairman.
All right, House Bill 1775 will go by for the day. Members, that has completed our docket for this morning. I think we plowed through pretty good for our first meeting. Thank you for your assistance. Are there announcements? Delegate Bell.
I say to members of the subcommittee, one or two. Subcommittee 2, so we will be meeting after the Thursday HWI, and you should assume we go right up to caucus. If we do that sufficiently, we can skip an evening meeting, so that's the plan.
With that, as a tee-up, also let the committee know if you're scheduled to be on a subcommittee, that the realities are the full committee's got to get through their docket, subcommittees do as well. With subcommittees meeting after full committee, the more we have extraneous questions and comments, let me say. The longer we drag out a full committee meeting, the less time subcommittees have. And if they don't have time, they're going to have to meet sometime outside of Tuesday, Thursday. Delegate O'Bannon.
So, Mr. Chairman, we have times on Monday evening at 5 if we don't complete our business.
I expect you to be
We will convene here in about 5 minutes. For those that are interested, the Narcan dispensing bills will not be heard today. They will be heard next Tuesday, except for one bill which is going to be on full Thursday, which is the
Thanks to the committee, thanks to the audience. The committee will rise.
It's just sometimes somebody's got to stop and say,